Though you may not have thought of. Some dentists report seeing a strange new pattern in their patients. We sent KMAX Laura Lawhead to investigate a phenomenon some are calling COVID cavities. Laura, what's the connection here, and is it even safe to go back to the dentist?
Brian, while it may sound weird at first, Houston dentist Dr. Pia Gandhi says that she's noticed an about 50 to 60% increase in cavities in some of her normally healthy patients. And the reason might be linked to wearing face masks. She's actually calling them COVID cavities. Well, the dentists I've talked to here in Lubbock say that it's not a problem here in the city yet. They share how it could be happening and why they think you should still be going to your dentist during the pandemic.
So now that a lot of us are mouth breathing while we have our mask on, we're drying out all that saliva, which usually protects our teeth from getting cavities. And so that's increasing our risk of getting cavities.
It's nothing new in the world of dentistry that less saliva means more problems for your teeth.
There's no question that dry mouth can cause cavities.
But as we breathe heavily from our mouths, whether through exercise or from an uncomfortable face mask, we can lose saliva, leaving our teeth exposed to decay. However, Dr. Gandhi emphasizes that this does not give you an excuse to leave your mask at home.
We don't want to stop wearing masks, but we want to be conscious of what we can do to help decrease the dryness in our mouth.
A solution she offers is going back to the dentist for your regular checkup.
Now that this is going to be around for a while, I think it's important that we get on top of our preventative visits.
They say now more than ever is the perfect time to schedule your checkup. A small cavity or pain in your mouth could easily lead to something much worse.
Anytime you have a toothache, that can lead to an infection. An infection can cause issues in the mouth, but also throughout the rest of the body.
But for those worried about going back, Dr. Johnston and Dr. Gandhi want to point out that they have the latest safety measures, like more PPE, empty waiting rooms, and additional air purifiers, among other things.
In my opinion, a dentist's office at this time is one of the safest places you can be.
To combat dry mouth and tooth decay when wearing your mask, both dentists suggest a combination of the following 3 things. 1, stay hydrated. 2, take breaks from your mask when it's safe. And 3, chew on something like mints and gum, but just make sure they're sugar-free.